Hello there. Hi, everyone. I'm Rendi Murphree, epidemiologist and director of disease surveillance here at the Mobile County Health Department. This is our Tuesday, December 29th, 2:30 update on COVID-19. Our live Monday update didn't go as planned. We had some technical problems, so we've decided to record our update today and broadcast it for you at 2:30. So thanks for joining us. So worldwide, we've seen more than 81 million cases of COVID-19, and the U.S. has nearly a quarter of cases in the world, at around 20 million cases of COVID-19. Worldwide, there are about 1.8 million deaths, and in the U.S., we have more than 340,000 deaths. It's just really staggering numbers. And I was asked earlier today if I thought, back in March when our pandemic began in Mobile, if I ever thought, that I would see things this badly or going this poorly. And I said, no, I did not. We seem to have been able to kind of keep things a little bit under control after our summer peak, but here we are in the middle of our winter season, our cold season, and we are seeing record numbers of COVID-19 in Mobile County in Alabama and in the U.S. and around the world. So in Mobile County today, we are reporting on 25,478 cases of COVID-19. 177 cases were added yesterday. Generally, our number's really low on Monday, but the holiday seems to always messes with things a little bit. So yesterday, 177. On Sunday, 233 were reported. On Saturday, 294. We saw only 66 reported the day after Christmas, 261 reported Christmas Day, and 317 COVID-19 cases reported to the Mobile County Health Department on Christmas Eve. 317. I mean, that number, we've not seen numbers like that since July, since our peak during July. So we have a total number of died with COVID-19 at 496. The cumulative number hospitalized, 3,155. 23 hospitalizations were added since yesterday. And yesterday, the total number of people hospitalized with a COVID-19 diagnosis was at 178. That, again, is among the highest numbers that we have seen. I think our peak number hospitalized back in July and early August, we had about 210 on a day or two back in July. So, again, we are seeing accelerated, widespread community transmission brought on by lifting of restrictions going into the fall, exacerbated by holidays and gatherings. And we will continue to see very high numbers as we go through the next couple of weeks following the Christmas and other holiday gatherings that have taken place over the past couple of weeks. So if we look at our weekly updated report, the week ending this past Saturday, there were 1,574 cases reported. That is the second highest reported since our outbreak began. Again, if we look at reports by week or by month, anywhere you slice and dice it, the numbers are going up. We're still seeing similar patterns in age group, where the younger age groups are responsible for the largest numbers and the highest rate of COVID in our county. Again, we're seeing on average about 200 cases, just over 200 cases added per day, and that we have not seen since late July and August. For the hospitalizations, on average, we're seeing above 150 on any given day. It got above that back in July. We're still hoping that with treatments that are available now for COVID-19, monoclonal antibody treatment, convalescent plasma treatment, remdesivir, we're hoping that the number of hospitalizations and deaths do not get as high as they were in summer, though they are continuing to rise at an alarming rate. So about over 150 hospitalized on any given day. When we look at the emergency department visits for COVID-like illness, That also is going back up. We're seeing an increase in ED visits for COVID-like illness. And interestingly, ED visits for, or any outpatient visit for things like influenza or other respiratory viruses seems to be staying much lower than we've seen in previous years, probably due to all the good mask wearing that's going on around there. Kids seem to be pretty good at wearing their mask when encouraged by their teachers and parents. So thanks to them for keeping some of those seasonal childhood respiratory diseases low. So we are seeing a higher number of deaths in recent weeks, though it is still lower than we saw in July and October and August. So the percent positive rate, so the number of tests that are positive divided by the total number of tests that are performed, is continuing to go up. It's around 13, 14, 15% in the traditional public health surveillance data. When we talk to our partners that are doing rapid testing and other types of testing in the community at urgent care clinics and at pop-up, drive-through testing clinics, they are seeing in the low 20% positive for the tests that they are conducting. So again, this is similar to what we saw in late July, August when it comes to the percent positive test results. Not surprisingly, the reports from schools are down. We've had children out of school for the week of the week of Christmas, so those numbers are down a little bit. Looking at the geography, I've been trying to share specifically in the last 2 weeks what zip codes have the highest rates. So this is per capita. The highest rates of COVID are still occurring in the 36571 zip code, also 36544 and 36509. Those last two are in South Mobile, the Bayou, and 36544. So if you're in those three zip codes, 36571, 36544, or 36509, you are in a hot spot for COVID transmission based on the number of cases relative to the number of people that live in those zip codes. So we are still continuing to receive a lot of referrals or complaints or referrals for people, places, businesses, restaurants that aren't complying with the mask mandate, or maybe are having, we have gotten so many reports just in the last couple of days about, school gatherings, school events outside of the classroom, but, dances and homecoming dances and other formals that have taken place, about large gatherings at outdoor venues that have Christmas lights, some very concerning things going on out there. And all of these gatherings are opportunities for super spreader events. So keep a close eye out. If you did go to a gathering, please stay at home if you can. Wear a mask if you go out, because if you were exposed over the Christmas holidays, you could become infectious. You could become sick with COVID or become infectious, able to infect others within 2 weeks of those gatherings on average. So that's the range, 2 to 14 days. So after about 2 weeks, we should have seen all the illness that we will see from people exposed at Christmas. But of course, for every one person that gets COVID, there is about 1.7 people that they will transmit it to. So every one person will give COVID to another 1 or 2 people, and that's how it just continues to spread and spread and spread. So wear your masks, wash your hands, watch your distance. All right, some questions here that I'll address. Someone was asking if there is a rapid test shortage. We are hearing, particularly after the holidays, people that gathered or maybe have returned from travel wanting to get tested. We have heard from members of the community that the lines are long, that the wait times are long for getting a test. I don't know of any specific shortages in town, but we are hearing from the State Bureau of Clinical Laboratories, the state public health lab, that there are some shortages, not necessarily of reagents this time, but potentially some shortages of plastics due to supply chain interruptions in both petroleum and plastic makers. So if you think about pipette tips or syringes or caps for syringes or plastics that are needed to package test kits, we're hearing that there may be some shortages in those materials. Let's see. So another question about vaccine allocated to Mobile County and administered to Mobile County. So we are reporting today that the State Health Department has reported or will report later today on news release. They are posting a new hub. So all of the various dashboards that they have published, the risk indicator dashboard, the COVID-19 dashboard, the school dashboard, and now a dashboard for vaccine distribution dashboard. Those will all be combined in a COVID-19 dashboard hub that can be found online, and once it's public, we'll share it on our social media. It will include the number of vaccine allocated to Alabama and the number of doses administered in Alabama. And that is the only level of granularity that we will be able to provide with you for now. Much like in the beginning of the outbreak, we are putting things into place to be able to provide, county level data for you. But right now, at the end of today, you should be able to see the statewide number of vaccines allocated and the vaccines administered. So stay tuned for that. Here is a comment, last question that we are getting a lot these days. It's when will senior citizens be able to get their vaccines? So I just want to review a little bit with you about the vaccine allocation. So there is this phase 1 and phase 2, and phase 1 has 3 parts, phase 1A, 1B, and 1C. So let's review these carefully. For 1A, healthcare personnel and long-term care facility residents and personnel. So that's where we are in the state of Alabama is 1A. ADPH allowed EMS personnel to be included since they transport patients, but the federal guidance is healthcare personnel, long-term facility residents. And again, ADPH extended to EMS service providers. So that is 1A. We are currently officially in 1A, and we may be that way for weeks because we received an allocation, and the state health department will have to do some figuring to determine if that allocation has reached all of the 1A individuals that are needed before we can move on statewide to 1B. 1B will include frontline essential workers and persons aged 75 years or older. I believe that's just for that's for all the vaccines. So 1B is now frontline essential workers and persons at least 75 years or older, right? We have not moved to 1B yet. So, and I don't know when we're going to get there. I don't know. The state doesn't know. We don't know when additional vaccine will be allocated. Right now, the only vaccines that have FDA emergency use authorization are the Pfizer vaccine and the Moderna vaccine. The state did not get as much Pfizer vaccine as they thought because of some transportation issues. I think those have been resolved, so hopefully that will loosen up some additional Pfizer vaccine. But the state only got 84,000 doses of Moderna. So, we're still in that 1A classification. The best way to find out when vaccine will be available to non-healthcare workers, so the general public, is to keep an eye on vaccinefinder.org and watch the ADPH website and the MCHD website. Unfortunately, calling us can't help your cause any. So right now, we're in 1A. We are currently not vaccinating 1B except for EMS personnel as directed by the state. 1C then includes person ages 65 to 74 and persons age 16 to 64 with high-risk medical conditions, and then the rest of the essential workers that were not covered in the 1B phase. And then in phase 2 will be all persons aged 16 or older or 18 and older, I think for the Moderna vaccine. Don't quote me on that. So again, it will be many months before we get all the way into phase 2, maybe 5 or 6 months. We are not yet in 1B. So please just keep listening and watching, and we will let you know as soon as we get there. Right now, we're still in 1A. So I don't believe we had any more questions than that. I'm getting the no sign that we're in the clear. So with that, I will thank you and wish you a very happy new year. I know lots of folks are looking forward to seeing the end of 2020. 2021 brings with us the hope and promise of a new year and the hope and promise of the end of the COVID-19 pandemic one of these days, if everyone who's eligible to receive the COVID vaccine will get vaccinated when it's your time. It won't be until we have at least 70% of our population vaccinated that we may be able to return to something that looks normal again, maybe not wearing a mask. And again, that's not going to happen for probably half a year, but we will only get there if you all continue to do the things that you can do to get us there by wearing your mask, watching your hands, watch your distance, and get vaccinated when you have the opportunity. We'll talk to you next week.